You to also go down and train.
We have seen the spirit in you.
The Director General of the National Senior Citizen Center, NSCC, Dr. Omokaro, has called for increased effort to end the rising incidence of elder abuse and stigmatization as the agency unveils a series of strategic initiatives embarked upon in protecting and promoting the rights and welfare of older persons in Nigeria. Speaking during opening section of the Quality Assurance Assessor Training and Certified in Geriatric Social Care in Abuja, she emphasized that the dignity of older persons must never be trampled upon, as she noted that it is a collective responsibility to ensure that all elderly persons in Nigeria should be treated with respect.
The commencement of training for the second batch of learners for the Quality Assurance Assessor certification. Quality Assurance Assessor certification is a major requirement for training providers, meaning that the multidisciplinary team that would train caregivers must have amongst them a good proportion of certified quality assurance assessors. So this will serve as internal verifiers of competency. That means that if you train, for instance, level 1, that's the basic geriatric social care, level, it means that all the units under that level, so we are training communications, how to talk to an older person, how to understand an older person, how to recognize abuse, and maybe you're training, in attitude, maybe you are training in just anything. It means that it's not teaching. You don't teach and get off and go, and you assume that the person knows. This one is not only head knowledge. Knowledge is important. This is translating knowledge into practice.
While raising concerns over the persistent abuse of elders in rural communities, particularly where inhuman cultural practice is long established, she highlighted that the recent abuse case in Benue State, where an elderly man was reportedly buried alive by local youth who accused him of causing a thunderstorm that resulted in multiple deaths. She enumerated that such abuse usually occurred in isolated communities, as the agency hands is on deck to end such practice.
It's a workable and very reliable partnership. First, National Human Rights Commission. 2, NAPTIP. NAPTIP, they are the custodian of the BAP law. And NAPTIP has allowed us the use of their call lines and their call centers. So if you see most of the NSCC adverts, you see call that line, call that line. If you call that line, that you have provoked their squad, their intervention squad. So now, there was a case in Cross River State, which was, picked up immediately. In fact, even the governor had to intervene also, so it was very hard. There was a case in Enugu State, and when I talk about it, I'm not even talking about the cities, I'm talking about the rural areas, no matter where it happens. It was a case in Anambra State, in Benue State, where an older man was buried alive, by youths. Why? Because thunder struck, and some people died in the family, and the older man was alive. So they said he caused the thunder. So it is working, and we only need to partner with more volunteers. Like we just came back from Akwa Ibom, where we ran workshops on elder abuse, for them to recognize elder abuse and to know how to use those numbers. So I'm appealing to the media, you are partners in this, to also help to, run these call lines. If you call that line, help comes. So the help is not only, to redress, remedy, it's also to prosecute. So we depend on our sister agencies to do that. But we on our part will create, will sensitize, will mobilize. Now we've developed the infographics for people to recognize abuse, So we are creating all these platforms, all these mechanisms, so people can recognize abuse, can deal with abuse, and can volunteer also to speak up for older persons.
Looking further, he said, the introduction of the National Identification Number (NIN) now enables older citizens to access grants healthcare support, and social welfare programs. He called for improved data collection to reach undeserved elderly population in the rural areas. Professor Piwuna said, as more states move to domestication of NSCC Act and develop localized aging policies, this will help to reach larger statistics of the elderly in the country.
Just like it is with most things, data. I think the center needs to keep updating data. We need to have access to elderly people in rural areas, so we don't focus on just elderly people within city centers or retired civil servants who know their way around the society. We have farmers who have never been involved in any formal work. Those people need to be covered. And I also think that once this data capture, social register for them comes into place, we would be able to support them even health-wise. They can go into hospitals and get discounts for their health care, or even for free, if finances of the agency or government allows that. So a major gap is issue of data to capture as many people, genuine data, that cannot be manipulated at any